844, 55 KRC, the talk station. A very happy Tuesday to you. Oh, I love when the doctors from OHC come in the studio to talk about all these advancements in treatments. Give me great optimism about treatment for cancer. We will find a cure thanks to the good people at OHC and their clinical trials and all the other research that's been going on out there. Welcome to the 55 KRC Morning Show, Dr. Courtney Hentz, brain cancer. And, of course, precision matters when you're trying to deal with brain cancer. And apparently one of the most advanced treatments out there is called GammaKnife radiosurgery, which I'm reading now, non-invasive procedure, highly targeted radiation to brain tumors. And OHC, the only provider of GammaKnife treatment in our region. So Dr. Courtney Hentz, a radiation oncologist and one of the great doctors at OHC and one of the expert physicians that does this life-changing procedure. Dr. Hentz, great to see you, and thanks for coming to the studio today.
Yeah, thank you for having me.
So you guys are cutting edge. This isn't really a knife.
No, it's not. It's a very focused kind of radiation that we give to tumors in the brain. No knife at all, no cutting, no incisions, and it's a great way to deliver high doses of radiation to tumors to try to kill them off.
So unlike the old way where you just sort of nuke the entire body, this allows you to concentrate that radiation to one spot?
Yes, that's right. It's very precise. We're talking down to the millimeter. And it allows us to give very high doses to our targets while sparing the normal, healthy brain tissue around it.
How quickly does this work? I mean, how quick is the result?
Typically, we're re-scanning or repeating an MRI on patients anywhere 2 to 3 months after, sometimes a little longer, depending on what we're treating. And usually by that first scan, we're already seeing results.
No kidding.
Yeah, it's great.
How many treatments does a person normally have to undergo to deal with, I guess, in many cases, tumors as opposed to a tumor, or it works in both cases?
Sure. So the most common treatment that I offer patients is when their cancer has started somewhere else in the body and has spread to the brain. So
metastasized.
Metastases,
oh,
yep.
Jeez.
And usually those lesions are quite small, so we can take care of them with radiosurgery. And generally, the most common way to give it is over one treatment.
Really?
So it's 1 day outpatient procedure. We work very closely with our neurosurgical colleagues at Mayfield Brain and Spine and through our collaboration with Mercy Health at Jewish Hospital, where we deliver the treatment.
Well, that's great. Now, I don't want to deviate from the brain tumor issue here. It's very important, clearly. Can that GammaKnife be used for the other cancers that have caused the metastasize, the brain cancer?
That's a good question. So GammaKnife radiosurgery is only used in the brain, sometimes the upper spine. But there are other very similar versions of radiation called radiosurgery that we can deliver with our other radiation treatment machines that can do a very similar process to other spots in the body.
So there's another vehicle to do the same kind of thing. So We're still not nuking the entire body and radiating everything and glow in the dark kind of stuff. That's good. Now, I mean, success rate. Before I'm going to ask you about the symptom or the kind of some of the problems that go along with it, like risks and that. But in terms of success rate for treating the brain cancers, the tumors, what are you seeing in this?
Yeah. So in general, when we're treating small lesions, which is the most common thing we treat with this, success rates of control are 90% plus. So very high. Yeah.
Oh, that's amazing. Mm-hmm. So what about side effects? We all know about chemotherapy and all that and what it does. Hair falls out, you're weak, you vomit. It's a nasty experience to have to go through. I presume that you don't have any of that with this kind of treatment.
Thankfully, with how precise the treatments are, the side effect profile is very low. So the day of the treatment, patients can feel tired and sometimes a couple days thereafter, but rarely are they having additional side effects like other neurologic issues, headaches, seizures, very rarely. And we do things to keep those side effects very low.
Well, and I can't, is it safe to call this non-invasive? There's no cutting, there's no...
Absolutely, yes. So despite the confusing name of GammaKnife, there are no knives involved, no incisions. It's an outpatient procedure, typically done in 1 day, and patients go home. And I've had plenty of patients return to work the following day.
And so side effects, I see like headaches, fatigue, that's not that big of a deal. So
Pretty
I don't want to
thankfully
understate it for someone like, I had GammaKnife. Don't tell me it's not that big of a deal. So who's eligible for this treatment? I mean, this is new. I mean, we're talking new treatment.
Yeah, so GammaKnife has been around for some time, but we keep getting better and better about how precise we can give the treatments and spare the normal healthy brain tissue. So patients who are eligible, most common that I see are those with brain metastases. So again, cancer that has spread from somewhere else to the brain, where we're trying to only target those lesions themselves. So it depends a little bit on what kind of cancer it is, how large or small the lesions are. And sometimes cancers that have started in the brain or primary brain tumors can be eligible for GammaKnife, but more commonly those are treated with another form of radiation. And GammaKnife is a great treatment for lesions in hard to reach areas where surgery is not indicated.
Okay. Because you can see them on like an image, exactly and get deep. And I presume all of this is computer operated. You can focus exactly where that little tumor happens to be. So,
yep, absolutely.
All right. Now, I've been speaking and supporting the Cure Starts now for about more than a decade. The story behind how that got started is such a heartbreaker. You got this 5-year-old girl who dies of glioblastoma, and there's not a lot of research on it because it's so deadly and it happens so quickly. Is there any hope that this kind of treatment maybe can be expanded to go after that type of brain cancer?
Yeah, so we actually do use GammaKnife radiosurgery sometimes in glioblastomas. More commonly, the first step of treatment for those is a longer, more protracted radiation course. But, if it recurs or comes back, depending on where and when, sometimes we are bringing this method in to treat just the small areas where it's trying to come back with good control results of that.
Okay, and considering this is a developing technique or practice or treatment, do you see it expanding down the road to deal with more types of cancers like other solid cancers? Because, this sounds miraculous right now.
Absolutely. So in a good way, our cancer patients are living longer with great systemic therapy options, immunotherapy. And so as patients live longer, sometimes they pop up with new spots that if it's just 1 or 2 spots, we use this very focused version of radiation, whether it's in the brain or elsewhere in the body, to control the, quote, problem child that's trying to grow through therapy. So radiation used in conjunction with their systemic therapy options are absolutely helping patients stay alive longer and stay on their therapy that they're otherwise tolerating well.
All right. Well, and I think you may have already addressed this with your comments about the other subject or questions I asked, but in terms of recovery time and everything, this is just light years ahead of traditional surgery. Because brain surgery, you're going into the skull, you're digging. You just have this horror show of people digging around in my brain and trying to ferret something out. Especially when you're talking about real teeny weeny little cancers, leaving a surgeon to sort of find it in spite of all the images and everything they might have. That's a bit of a crapshoot in and of itself, isn't it?
Yeah, and our neurosurgeons that we work with are excellent in their craft, and they actually are very involved in the radiation planning and treatments for these GammaKnife procedures. And the recovery for patients compared to traditional surgeries in general is much faster. Again, it's typically done in 1 day, maybe even a half a day, and they're going home that same day and back to feeling relatively normal that following day.
Now, this GammaKnife is not considered experimental. This is standard of care level stuff now. So this isn't a clinical trial setting, is it? No,
absolutely. It's standard of care for small metastases in the brain, as long as there are not too many, and we can appropriately target all the small ones there. And sometimes even if there are more larger ones, we can treat it instead of doing it over 1 treatment, it might be as many as 5 treatments.
Okay. But still, I'm going with the optimistic note on this. This is just amazing stuff, and it's always amazing at OHC. These are my cancer doctors. I put my health and my life in their hands. I've gotten wonderful treatment there, and I've recommended them for years because if you treat if the other cancer sufferers like you treat me, they're in great hands. So get in touch with OHC. If you have a cancer diagnosis, you want a second opinion, or you need to speak with a cancer doctor, give them a shout at 888-649-4800. 888-649-4800, or visit the website. Learn a lot more there. It's ohcare.com, ohcare.com. You're in great hands. Dr. Courtney Hentz, it is a real pleasure meeting you. What an exciting treatment option for folks dealing with probably one of the more problematic cancers, brain cancer. This is great stuff.
Yeah, well, thank you so much for letting me speak about the wonderful treatment option we have for patients.
I love it. Gives me hope and optimism for the future every time. That's why I love having you in here. ohcare.com. Folks, if you didn't get